Hello, everyone. Thank you for joining me in another live stream event. My name is Melissa Favela, and I am the community educator for Southern Caregiver Resource Center, where we care for those who care for others. Now, I invite you to get comfortable if you can, grab a pen, a notepad to take notes if you'd like. But remember, this live stream is always available to watch after the live stream ends via our YouTube channel. And you can access that via our website. Now, without further ado, let's get started with today's presentation. We will be talking about understanding visual impairment, impacts, challenges, and the caregiver's journey. So let's get started with our learning objectives. We will hopefully understand a little bit more about the impact of visual impairment in everyday life, challenges of visual impairment, and of course, family caregiving, and strategies to support family caregivers and individuals with a visual impairment. Now, this might be more of a review for some of you, but I really hope that you get some information or resources out of today's presentation. Let's get started with our statistics. Now, we always like to mention statistics because it really shows the relevancy of the topic that we are discussing. Now, something to note is that visual impairment is ranked third behind arthritis and heart disease as the most common condition, causing a need for assistance with activities of daily living for people 70 years or older. It is, however, often overlooked in the home care settings when treating patients for other conditions. Now, the English longitudinal study of aging has found that total blindness occurs in about 5% of the visual impaired population, and that people with poor eyesight are 3 to 5 times more likely to suffer from low quality of life, poor psychological health, and even depression than those people that have unaffected eyesight. However, when those inequalities are accounted for, this study found that the impact of poor eyesight itself makes almost no difference. By awakening and strengthening other senses that have lain dormant in deference to sight, up to 99% of all normal daily living activities can be continued, and quality of life can be maintained. Now, let's discuss what visual impairment is. Now, the Department of Ophthalmology from the University of Pittsburgh defines visual impairment as when a person's eyesight cannot be corrected, either with glasses, medicine, or surgery, to a normal level. Now, vision impairment may be caused by a loss of visual acuity, where the eye does not see objects as clearly as it usually would. It may also be caused by a loss of visual field, where the eye cannot see as wide an area as usual without moving the eyes or turning the head. Now, there are different ways of describing how severe a person's vision loss is. The World Health Organization has a variety of official definitions that we will not go into detail today, but if you're curious, you can always go onto the World Health Organization's website. Now, vision impairment, the severity of the vision impairment may be categorized differently for different purposes. And this is because, for example, in the United States, we use the term legal blindness to indicate that a person is eligible for certain education or federal programs. That's just an example. Now, question, do all people with the same visual impairment use their vision the same? Well, as you might have guessed, the answer is no. It is also important to assess how well a person uses the vision they have. Two people may have the same visual acuity, but one may be able to use their vision better to do everyday tasks. Now, most people who are quote unquote blind have at least some usable vision that can help them move around in their environment and do things in their daily lives. A person's functional vision can be evaluated by observing them in different settings to see how they use their vision. A functional vision evaluation is needed and can answer questions such as, Can the person scan a room to find something or someone? What lighting is best for the person to do different tasks? How does the person use their vision to move around in a room or even outside? So all of these things can be determined and evaluated with that vision evaluation. Now, something to note, normal eye aging does not lead to low vision, and we'll talk a little bit more about that. Now, everyone experiences vision loss differently, even those who share the same conditions. Most chronic diseases begin with no symptoms, then progress through various stages of blurriness, distortion, dim areas, and finally blind spots in either or both eyes. Now, many eye diseases can cause low vision. The following are just a few of the most common ones, and I will go ahead and describe them, and then we'll see images of them as well. For example, our first one here is age-related macular degeneration, also known as AMD, and this blurs the center of vision, degrading details of objects, print, and faces. Now, the side vision or the peripheral vision remains intact and can be used effectively. It is most common in people aged 60 and older, but there are also some juvenile forms. Now, diabetic retinopathy is caused by abnormal leakage or growth of blood vessels in the back of the eye or the retina, and it may occur in anyone affected by diabetes, and it can affect both the central and peripheral vision. Now, glaucoma is a disease of the optic nerve, and this nerve carries the images we see to the brain, and that way the brain interprets what we're seeing. It is usually associated with elevated pressure in the eye, and when damage to the optic nerve occurs, blind spots develop that usually go undetected until significant damage is done. Now, cataracts, these are more associated with cloudiness of the eye's lens, commonly affects people over 65 or older, and surgery can replace the cloudy lens with an artificial one, improving vision significantly. And we also see here retinitis pigmentosa, which is an inherited condition causing gradual retinal degeneration and loss of side vision. Now, this leads to what is commonly known as tunnel vision, and it impacts night vision and mobility, but complete vision loss is rare with retinitis pigmentosa. Now, I'm going to say stroke. However, stroke is not actually an eye disease, but it can seriously impair vision. It results from rupture or blockage of blood vessels in the brain, depriving parts of it with accurate or adequate blood supply. Now, various symptoms can occur depending on the side and the extent of the damage. Now, it does affect the visual messages coming from both eyes, usually eliminating perception on either the right or the left halves of the visual field, and detail vision, even though it might not be reduced, but it can make, for example, reading difficult. So again, these are just some of the most common ones or most heard of ones. And now on our next slide, we will look at visual examples of what these common visual impairment conditions may look like when people have them. Now, going from left to right, top to bottom, or simply the number one, we see an example of a visual representation of what macular degeneration, looks like. Now, notice how the central vision is affected. Now, number two is diabetic retinopathy. And here you can notice how the central and peripheral vision is affected. Number three, we see glaucoma. Number four, we see cataracts. And number five, we see retinitis pigmentosa. And this I would highlight the tunnel vision that I mentioned in the past slide. So again, these are just some visual visual images of how people with these conditions perceive the world. Next slide, please. Now, moving on, now we know some of the most common conditions, we know statistics. Let's talk about signs of visual impairment. Now, the American Academy of Ophthalmology gives the following signs to look for that may indicate visual impairment. We can see slowness in responding or moving, or the person has a fear of falling. The person may also show signs of confusion in environments where there's low contrast or low lighting. We can also see people getting confused with faces or even identifying people, not really recognizing faces. We can also see difficulty locating objects that are very small or the same color as the backdrop, right? We're looking for a white piece of paper on a white desk, as an example. And another one would be driving, right? People don't feel comfortable driving, or they drive, but it's not very good driving, maybe. But maybe they don't want to tell someone else that they're having issues with driving, right? Hopefully not, but some people may get into accidents as well. So things to look out for. Others include avoiding activities requiring good vision, like reading, using a tablet, even writing. Another one can be making mistakes in tasks that have small details. Like, for example, if there's different types of medications, people take the wrong medication because maybe the bottle has very fine print. And if, let's say, both of the pills are the same color, then that's going to be a big issue. And ultimately, it could be dangerous. So these are just some of the signs that the American Academy of Ophthalmology tells us that are common and early signs of visual impairment. Now, the diagnosis. This is a question or a slide that we always have questions on, or it's very popular. People want to understand how diagnosis is done. Well, before we start with that, I do want to highlight and mention again that low vision is not a normal symptom of aging. If you have noticed changes in your vision, see your eye doctor right away. Regular medical eye exams by an ophthalmologist are important to diagnose eye diseases early. It is important to treat any conditions that are treatable. Your eye doctor will do a complete eye exam to diagnose what is affecting your vision. Now, the exam usually begins with questions about your medical history and any vision loss problems you might be experiencing. You will have tests designed to check your vision and check for eye diseases, and your doctor may use a variety of instruments and aim bright lights at your eyes. Your eyes may also be tested for visual acuity or how well you see letters at a distance. If you are having trouble doing things other than just reading small print, your eye doctor may refer you for vision rehabilitation, and you can also ask your ophthalmologist to find vision rehabilitation programs and specialists in your area. That way you feel comfortable and maybe don't have to travel as much. And again, if you are caring for someone, this is also an awareness of what the diagnosis might look like so that you have that information when you go in with your care receiver. So what is vision loss? It's the reduction or impairment of the ability to see. Losing vision does not mean giving up activities. It may just mean learning new ways to do them. Vision rehabilitation helps patients to learn new strategies and find devices that can assist them. Now, the experience of vision loss, it is important to acknowledge that anger and frustration may be associated with this process. And you may even feel that the vision loss is gonna change your life forever, right? That maybe in your case it is irreversible. Well, getting help to work through these feelings and learn about the strategies of vision rehabilitation will help you stay active. And really, we want to make sure to avoid depression. Because again, there's resources out there. There's ways of applying strategies. Now, remember, you can live well with low vision, but you cannot live well with depression, right? So we're putting it in a balance. Now, counseling and a good support group can help you recognize that your value does not depend on your vision. You are worth the effort, the effort to find resources, to find what works for you, what doesn't work for you, and how to make the most out of the vision that you do have. Don't let it stop you. Don't isolate yourself. Keep your social group, your job, outside activities. Now, yes, you might need larger print, you might need a magnifier, you might need someone to drive you to events or additional help in general, but it is possible. Now, it is important to ask for the help that you need. Staying home to avoid asking for help is not independence, right? It's not a strategy. And a lot of times, and we'll talk about this, friends are honored to be asked and they're happy to help. So if you are a person experiencing vision loss, or if you're caring for someone who is experiencing vision loss, remember that there are strategies, that there are ways to go through this process. Next slide, please. And speaking of which, we have living with visual impairment. A person with low vision uses both visual and non-visual cues. Now, of course, this depends upon the amount of eyesight presence. Now, training and developing of using other senses is very helpful. There are also such a large variety of technological advances and tools that can help the person with visual impairment, and that way they can adjust to everyday tasks. Now, patience is very important, as of course this is a process and it may take longer to accomplish certain activities. Keep in mind that depression is common in people with visual impairment and it can be debilitating, but again, help is available. There are resources available for you. So if you or a loved one is going through the challenges and adjustments due to visual impairment, please reach out for help. And again, whether it be a loved one, a friend, or an organization. Now, if a family member or a friend has vision loss, they ideally need to learn to do as much as possible, as independently as possible, and of course, as safely as possible. Now, living with visual impairment requires change, but again, it is possible. It's a matter of using strategies and adjusting. Next slide, please. Now, I've mentioned rehabilitation team or rehabilitation a few times now. So this team, this rehabilitation team, may include just a few of the following, all of the following, or even more, right? So in this case, it would include the ophthalmologist, a low vision specialist, occupational therapist, rehabilitation teacher, orientation and mobility specialist, which is it's also known by COMS, a social worker, a counselor, and even an assistive technology professional. So as you can see here, there are a lot of resources, there are a lot of things to tackle, and a lot of strategies that can be applied ultimately to adjust to the new living situation. So the following question that we get is, what do I look for in vision rehabilitation services, right? This is new. I haven't done this before. Well, here are a few things that you can look for. You can check out low vision rehabilitation services near you and ask if services include a low vision evaluation by an ophthalmologist or optometrist, if they have rehabilitation training, for example, for reading, writing, shopping, cooking, lighting, glare control, if they provide home assessments, if they provide mobility services, and if they have additional resources and support groups. Again, of course, you can always cater what to look for in a rehabilitation service, but these are just a few things that are there to get you started, a few ideas to get that list started when you're looking for rehabilitation services. So again, just a few ideas, and these are just some of the professionals that might be included in the team, but it is to get you started. Next slide, please. Now, the vision rehabilitation team's assessment is different than the eye examination by the eye doctor because it is not focused on diagnosing or treating the eye disease, but rather it's focused on helping you or the person with vision loss find ways to continue to do tasks despite the vision loss. Start the process of vision rehabilitation as soon as possible, or encourage your loved one to start this process as soon as possible, because as as people experience limitations or difficulties from a loss of vision, this will change their lives. So it is important to start the process as soon as possible, and even consult with your doctor if you're just getting started or if your loved one is just getting started with this process. Now, the vision rehabilitation team will assess additional aspects of how your eyes function, how you accomplish tasks, and of course what your goals are. That way they have a parameter at which they will work with. Now, they will help you new ways to use your remaining vision or find new strategies to complete everyday tasks and maintain your quality of life. Remember, the first slide I mentioned that there were some disparities. People with low vision had lower quality of life, but when they were able to do their ADLs on their own, really that wasn't the case, right? So the rehabilitation services team, their assessment, the way they tackle this specific vision loss of that specific individual will really make a positive impact in overall quality of life. Next slide, please. Well, we're getting to the technology part of vision loss. There are many low vision devices to help with daily activities. Of course, because this may be new to you, you should always talk to your vision rehabilitation team. They can help you find solutions that are specific to your case or your loved one's needs, and also ask if they'll need training on how to use any of these devices that are recommended. Now, that being said, there are a few popular ones, and they're the ones that you see here on this slide. We have optical low vision aids. These use magnifying lenses to make objects look larger, and that way they're easier to see. We also have correctly refracted glasses. This is maybe more for pediatric use, but again, it is something that is beneficial, but it is a very accurate prescription that is needed. We also have magnifying spectacles, and these are worn like eyeglasses to keep your hands free. They can be used for reading, for threading a needle, or doing other close-up tasks. Often objects need to be held much closer with these magnifying glasses than with regular reading glasses. But again, they do allow you to look at things that are very, very, tiny or specific. We also have stand magnifiers. These magnifiers rest above the object you are looking at, and this is hands-free and helps you keep the magnifying lens at a proper distance. Being on a stand is also helpful to people who have a tremor or arthritis, and some stand magnifiers have built-in lights. So again, this might be something that works better for some people and not as great for others. We can also have handheld magnifiers, right? So these are you can move them around, you can carry them in your purse, in a pocket. They're just easy to move, right? And there are a ton of models. Some of them even have built-in lights as well. There's also telescopes. Maybe we don't think as telescopes as an assisted device, but these are used to see objects or signs that are far away. Some telescopes can even be attached to eyeglasses. Others can be held like binoculars. So again, these may be devices that we don't think of as everyday use. They can become for everyday use for our vision loss people. We can also have non-optical devices such as watches, timers, um, devices that make audible announcements. For example, if people need to check their blood pressure, they have blood pressure machines that can make that audible announcement, and that's a way that, or it's in the category of a non-optical device, right? So again, making sure that we know that these things exist so that people can use them in their everyday lives and have that ability to be more independent. Of course, there are also large print books, large print magazines, audible books, telephones, thermostats, watches with larger numbers, high contrast colors. We have video magnifiers. We have, I already mentioned audiobooks and electronic books. Of course, smartphones, right? Tablets, computers, anything and everything can potentially be an assistive device. Sometimes it's just finding the way of using it or knowing that maybe there's a setting for vision loss folk. So again, just making sure that we know these things. Now, something that I'd like to mention here is that people can sometimes have old equipment, right, or old assistive devices. So instead of disposing them or just recycling them, a lot of times you can donate them to a vision rehabilitation center or a nonprofit organization or a support group, a public library, etc., right? A retirement facility even. Many of these devices can be refurbished or donated to help others, even though they might be a little bit on the older side. A lot of times they can be used for educational purposes, props, etc. Now, if you're looking at prescription devices, you can always ask the following. For example, before committing to making a purchase of a prescription device, you can ask if it can be loaned to you before the purchase or if it's returnable if it doesn't work out. It is important to ask if services are free or if some devices can be billed to Medicare or other insurance, right? If not, make sure that you're asking what is the price. Now, something to note for our veterans with vision loss, the Veterans Administration usually covers evaluation and devices, but again, it is important that you ask the insurance or your doctor that if you're worried about pricing, that you're asking these things ahead of time. Next slide, please. Thank you. Well, now we are switching gears here a little bit. We're going to talk about caring for the visually impaired. So if you are the caregiver for someone who is visually impaired, well, then follow visual impairment care team recommendations. That's the first thing. That's number one. Additionally, you can use low vision techniques to help with everyday tasks, but the first thing is to follow the care team recommendations. Number two can be improved lighting, right? Use a gooseneck lamp or have more lighting and useful lighting for the visually impaired person. Replace light bulbs with higher lumens. Maybe add, let's say, if there are ramps, if there are stairs, make sure that those are well lit areas. Reducing glare, that's also important when it comes to lighting. We can adjust lights inside so they don't create glare. We can cover shiny surfaces. We can also encourage people to shield their eyes by wearing a hat or a ball cap, a visor, etc., especially when they're outside to reduce glare. We can also increase contrast. We can use a colored tablecloth to have, let's say, a meal if we have white dishes, so we don't want white on white, right, as an example. Or we can put black contact paper on a desk where you have white papers, as I mentioned earlier. We can use contrasting colors such as black with white or black with yellow, blue with yellow, etc., right? We do want to make sure that we're limiting the colors because it can then become very chaotic, very, very confusing. So we do want to make sure that we're kind of keeping more of a strategy when it comes with these contrasting colors. But again, that is an option. Now we can also use heavy, bold felt tip markers when we're writing lists or taking notes that the visually impaired person will then look at or read. We may want to also avoid using cursive. And if, let's say, we're communicating via email, not in writing, we can use rich text. We can maybe set the font size to 16 points. And we can maybe use also easy to read fonts like Veranda or Arial. So again, lots of things that we can adjust. And we can also help the person that we're caring for see with their ears by describing locations or describing people, objects. We can also use the clock face as a strategy or as a method to help the recipient locate food on the plate, as an example. And of course, include them in social events, encourage participation in a support group, make sure that they are out and about, that they're socializing, that they are encouraged to really connect with others. Next slide, please. Now, a few things to be mindful of if you're a caregiver. Really, as a caregiver, really recognize the challenges of vision loss. But that being said, do not take over the tasks of your care receiver, right? Instead, we can help identify the adjustments that they may need to make to maximize their independence, of course, in a safe manner. But we want to make sure that we are not taking over their tasks. Now, a caregiver may assume that the care recipient is more impaired than is actually the case. So the caregiver may, again, start taking over tasks that the care receiver may be able to handle on their own. The care receiver may become over dependent on the caregiver. The care receiver may feel that their autonomy and personal choice is being compromised or is gone. And the caregiver may feel burdened or even taken advantage of. So really, this can lead to erosion of the original relationship, adding stress to both parties and possibly having a negative impact on the health and our safety of both persons. So again, making sure that these are things that are understood and applied. Now, when guiding, allow the recipient to maintain contact by grasping your arm or the caregiver's arm. On stairs, make sure that you're remaining one step ahead. When guiding to a seat, allow the recipient to touch the chair or bench first, then seat themselves. You can also, of course, use verbal description. You can describe the style of the seating. That might be helpful for them. And you can emphasize the importance of good nutrition and exercise. Always make sure that you're encouraging movement in a safe manner. Now, caregivers may be coping with frailties or limitations of their own. So that is something that we always mention here at SCRC. That includes, for example, the sandwich generation caregivers, where they are caring for young ones, then they're caring for older relatives or relatives with conditions such as vision loss, but then the caregiver themselves, maybe they have diabetes, maybe they have another health condition that they also need to manage, right? So this means that the caregiver may have added stress, and the care receiver may also struggle with the caregiver stress, right? So it can go both ways. It can also cause feelings of guilt and frustration for the care receiver, who may feel that they are adding to the caregiver's problems. So again, making sure that these are things that are being discussed, not ignored, that communication is happening in a healthy way, in a healthy manner. And then again, remember that support is available. There are support groups. There are many things. And I'll talk a little bit more about those as we reach the end of our presentation today. Next slide, please. Now, vision impairment etiquette. This is something that maybe anyone and everyone can benefit from learning this. So these are just some general recommendations. One would be speak in a natural communication tone. It's not necessary to speak loudly. Enunciation is important, but um, we may not be able, or people with visual impairment may not be able to see lips, but they can still hear, right? And if they can. So really, it is not necessary to speak loudly, unless we're in a crowded space, and you would do it for anyone. You can also address them personally, not through someone else. Greet them when they enter the room, and that way they'll also know that you're present. Indicate the end of a conversation when you leave them, so then they aren't just left talking to the air. Feel free to use words that refer to vision. They also use words see, look, watch, etc. And of course, if there's a dangerous situation, be calm and clear about what to do. Now, some other etiquette recommendations to consider is that if you think that they need help, make sure that you're asking them first. Do not assume that they want your help. Now, when offering assistance, never take them by the arm. Maybe you can offer your arm instead, or that way they can follow slightly behind and anticipate changes. Never take hold of their walking cane. Never pet or interfere if they have a guide dog, right? The guide dog is working, they are on duty. So again, very basic, but some recommendations that we can all benefit from to really encourage communication and participation and socializing with people who are experiencing vision loss, and to make them feel comfortable as well. Next slide, please. Now, a lot of caregivers have to adapt, of course, to being a visual impaired caregiver. Now, these are just some tips and some perspectives on how to adapt if you are a newly visually impaired caregiver. Make sure that you are willing, that you are determined to explore new directions. The care receiver's quality of life can be maintained if the caregiver is persistent in helping and searching for the tools and resources needed to overcome obstacles. Make sure that there's willingness to change ways of doing things, right? Change is scary, but in this case, change is also needed. When a person has no choice when it comes to losing vision, it can be very frustrating. But there are choices when it comes to living with it, right? Make sure that you as a caregiver and, along with your care receiver, can show adaptability by thinking outside the box, working together, reaching out for help. Finding support from others, right? Caregivers, family members, friends, organizations, they can provide the understanding and assistance needed to cope with low vision. That's what they do, right? In case of organizations, that's what they do. They are there to help you through this transition. And also considering increasing knowledge as a tool. Being a caregiver is challenging. We know that, we understand that. But most of the time, we do not have that extra time, right? But in this case, understanding that increasing our knowledge on the condition as a caregiver will be an extremely important tool to make caregiving easier in the future. So we're investing more time, we're investing effort, we're investing mental space and adaptability and changes now, so that the future things go smoothly, right? Things get easier. So that is something to consider. If you feel that you don't have time, I don't have the time right now, maybe later, maybe we can switch that way of thinking and say, I'm going to make time so that I have more time later. Next slide, please. Now, something to note here is that there are also visually impaired caregivers, right? So there are people who are living with low vision, maybe blindness, and they are caring for someone else, right? And that someone else may not be visually impaired. We here at SCRC, we have an excellent podcast episode where we talk about this topic, and I will share with you which episode that is. But again, visually impaired caregivers are out there, and they have adapted to their visual impairment, and they are going above and beyond to care for someone else, as we know all caregivers do. So again, we want to make sure that we're honoring that and that we are bringing attention to them. So I will go ahead and share the podcast episode towards the end of the presentation if you are interested in learning more. Next slide, please. And, we say it all the time, caregiving can be an important part of any level of the continuum of care, right? Unfortunately, family caregivers do not often receive training in how to deliver complicated care. And a lot of times they don't take advantage of resources and support services that can help them be more effective because they have limited time, right? They are doing a lot. Now, if the care recipient is visually impaired, that can add a considerably amount of responsibility to caregiving. So we want to recognize that caregivers give freely. They give their time, they give their attention, their love freely. They allow the care receiver to activate their own capabilities. They are respectful in how they help. They wait to be asked for help. They hopefully, and this is something that we're always pushing for, that they're practicing good self-care to be of better service to their care receiver. They focus on the solution and not the problem. So again, we really want to recognize caregivers going above and beyond for their visually impaired loved ones. Next slide, please. Now, as I mentioned, SCRC has more than a few resources that might be beneficial for caregivers who are going through this process or have been going through this process, but maybe need a refresher or need additional resources. We have quite a few videos on our YouTube page. The ones that I wanted to highlight are Steps to a Safer Home, Fall Prevention Strategies, Thriving Caregivers, where they prioritize mental health and their well-being, Nourishing Well-being, the role in nutrition, and making the most out of the doctor's visits. I had also mentioned our podcast episode, and this is episode 64, Visually Impaired Family Caregivers, where we had social worker Carrie Kennedy from the Braille Institute talk to us about visually impaired family caregivers. So I would highly recommend you listen to this episode. And additionally, we also have fact sheets that you can read online, or if you want to download them and print it out, fact sheets about vision loss and blindness, and of course, caregiving at home, a guide to community resources. So again, SCRC has plenty of resources for you on our website. Next slide, please. I also want to mention other resources that you can connect. If you're local to the area, I mentioned Carrie Kennedy from the Braille Institute. They are a wonderful resource. We also have San Diego Center for the Blind, National Library Service for the Blind and Print Disabled, the American Printing House for the Blind, and of course the U.S. Department of Veteran Affairs for our veterans. So not a complete list, a full list, but definitely a good starting point. And if you reach out to them, they can also point you into other resources or other services. So again, the importance is creating your own network of resources that will work for you and your care receiver. And just to give you a little refresher, a little reminder of who Southern Caregiver Resource Center is. We are a nonprofit organization that serves all of San Diego and Imperial counties, and we provide free supportive services to family caregivers. We have family consultants, support groups, individual counseling sessions, legal and financial consultation, a lot of education, which these live streams are part of, and also the online resources that I mentioned. We have specialized evidence-based programs. We have employer resources. We have respite. So again, if you are a family caregiver and you are in need of assistance, you can reach out to us. But before we go on to our contact information, let me tell you a little bit more about our TLC program. Next slide, please. Our TLC program, which is for Thrive, Learn, Connect, is for those family caregivers who are caring for someone who has memory loss, Alzheimer's, dementia, and this is a program, a free program for caregivers to learn coping strategies to avoid caregiver burnout, prevent isolation, and ultimately avoid depression. So if this is something that you think you might benefit from, please get in touch with us. Next slide, please. And I did mention all of the resources, wonderful resources we have online, and you can access all of them via our iCare portal tab. It's very easy to use, very easy to access. We have quick tip videos, which we call the Caregiver Corner. We have our podcast, which I did mention, called Let's Talk Caregiving. We have a lot of other pre-recorded classes or live stream presentations that are now in our YouTube page. And you can also sign up to our digital newsletter. That way you can stay updated with all the things that SCRC is doing out in the community. And if you are active in social media, you can scan this QR code and you can connect with us in whichever your favorite social media is. We are active in Facebook, Instagram, YouTube, LinkedIn, and we even have Pinterest now. So if you have a Pinterest board, you can go ahead and look for SCRC there. And last but not least, on the next slide, we have our contact information. Again, if you are a family caregiver and you recognize that you need some sort of support, or maybe you want more resources, information, feel free to reach out to us. You can do it online via our website, www.caregivercenter.org. You can self-refer to us, or you can send us a message there. Or if you do want to speak to someone, you can call us toll-free at 800-827-1008 or 858-268-4432, and we can answer your calls Monday through Friday, 8 to 5. And if you're calling outside of business hours or on a holiday, you can leave us a voice message and we'll get back to you within 48 business hours. So again, we want to hear from you. If you're a family caregiver, please reach out to us. Now, that being said, thank you so much for joining me today. I appreciate your time. I hope this is of benefit to you and your care receiver, and we'll see you on the next live stream. Have a great day.